tell you. I believe I heard you say
I don't think I said that,
okay.
but that's okay.
Okay.
I stipulate.
Yeah. Next week he's supposed to give a big speech about Medicare for All. What do you hear from people? Because there was some interruptions here with Congressman Delaney, someone who did yell Medicare for All.
Yeah. And
there seems to be a divide in Waterloo with some rural folks out here also attending this event who are worried about the consequences of it. What's your message, and how do you convince people?
Here's my message. One foot in front of the other, but here's my message. My bill, Medicare X, starts in rural areas with 1 or 0 providers, and then it rolls out to the rest of the country. And I did that on purpose. And by the way, I didn't do that because I was running for president. I had the proposal for years. Tim Kaine has been my original co-sponsor on it. And the reason I did that was that I'm trying to pull the country back together again. When we passed the Affordable Care Act, there was a lot of division in the country about what we were trying to do. And there were a lot of people in rural areas who were calling it a Bolshevik takeover of the American healthcare system. And of course, that's what Mitch McConnell calls it. Of course, that's what others call it. And now, with my Medicare X program, what I'm hearing from people in rural areas is, thanks for thinking of us. Finally, somebody's thinking of us. So I think this is really critical for us to litigate as Democrats because there are states all over the country where I think it's going to be incredibly hard to sell Medicare for All. Bernie couldn't pass it in Vermont. It failed in Vermont because taxes would have had to go up 10% on the people of Vermont and 11% on businesses on top of that. And they said, no, we're not going to do that. It failed by 80% in Colorado. It failed by a huge amount in California. Now, maybe somebody can figure out how to make it work in a state, and I think that would be great. But in the meantime, I really do think it would be great. But in the meantime, what I want is for us to have universal care for Americans, and I think the best way to do that is a public option.
You talk a lot about Mitch McConnell and how difficult he is to work with. Many of your fellow candidates are asked by not just us, but caucus goers here in Iowa about how they'd work with Mitch McConnell. And they seem to say, well, I've worked with Republicans before. We can get a few good Republicans in Senate. Do you think your fellow candidates understand how difficult it's been to work with?
First of all, would put my bipartisan record up against anybody. Mm-hmm. So, as I said, I was on the Gang of Eight. I mean, we got 68 votes in the Senate on one of the hardest things that you can do. Obviously, it didn't pass through the House, and that's a problem with the Hastert rule we can talk about. My work with Lamar Alexander on ending No Child Left Behind and rewriting the Elementary and Secondary School Act. My work with Richard Burr to create more than 100 breakthrough therapies so that people that are cancer patients and cystic fibrosis patients and others can get drugs. So I didn't take a back seat to no one in terms of bipartisan outcomes. But I do think that we have a combination of the structural barriers that I mentioned in there around gerrymandering, Citizens United, and others, and you've got an ideological barrier in the form of the Freedom Caucus and Mitch McConnell, who think they've basically been sent there to dismantle the federal government. My solution for that is that we have to either beat them or close over them. And I think the way we do that is by creating an agenda that's broadly appealing to Americans and allows us to win states like Colorado and Iowa and Arizona and North Carolina. And the policies cannot be policies that are being rejected by Vermont and California and expect us to be able to win these other states. It's just not going to happen. It just won't happen. And it will not bring rural America together with urban America. It just won't do it. And that's one of the reasons I'm in this race. And by the way, for me, it's not about moderate versus progressive or any of that stuff. It's about whether you can actually make progress on behalf of the American people and break the logjam in Washington, D.C. I think the last thing we want to do is have more of a logjam in Washington, D.C. We got to fix it. And if we keep doing what we've been doing the last 10 years, my generation will be the first to leave less opportunity, not more, to the people coming after us. So I'm serious about this, and I look forward to hearing his speech. What I hope he says in his speech is that what we all really want is universal health care in this country, and we should find a way to work toward that. What we all want to do in this country is reduce the cost of health care for families and for the federal government. We have to do that. We're spending twice as much as any industrialized country in the world. That's why my bill requires Medicare to negotiate drug prices on behalf of patients. And we need to preserve the quality that we have and enhance it where we need to enhance it. That's what we need to do, and those objectives satisfy a living room test that I apply in urban areas and suburban areas and rural areas. And people say, you know what, that is what we should do. That's what we want to go fight for. They're not for a plan that takes insurance away from 68% of the American people. And by the way, somebody asked me in there, why do you love private insurance so much? I don't care. I've had private insurance that sucked. And I've had private insurance that was incredible when I had my prostate cancer. So what I believe is that the fastest way to get into universal health care in America, which is what we need to do, is by designing a plan that gives every American family the choice for themselves about what it is they want.
Senator, how